Safety. This is what not to do in safety. Spill, she didn't clean it up. She left a knife off the side of the counter. She left the hand handle outside in the walkway. Now her colleague comes, falls, the pan falls on her, she gets stabbed with a knife. There's a frayed cord. He goes to plug it in. Not a good idea. He has a fan. Brings it across the hallway. Of course, the cord is across the hallway. Someone might trip, like he did. The chemical cupboard was not locked. And someone left the chemical on the counter. A resident comes in and uses the chemical as hairspray. Pulls the drawer out for files. And he leaves it out. And someone comes and trips over it. Okay. We're going to talk about types of injury and illnesses in nursing home. The main injury in nursing homes, over half, are bodily reaction exertion injuries. Falls comes in next with contact with objects and equipment. Assaults and violent attacks from people. Substances that are harmful, being exposed, and then other. 68.6% of the nursing aides make up injuries. The other is 7.1 for other staff in the nursing home. LPNs come in next with 6.4. Other health people, 5.5. Housekeeping, 4.7. RNs, 2.5. Cooks and janitors, all about 2 to 3%. Laundry comes in that class as well. Most of the injuries are from patient resident. Others are from tools and chemicals. Floors and walkways are another area where we can have trouble with safety in a home like this. In the Rose Hall, there's a right turn in there, and you need to walk on the right side of the hall, but use the mirrors because sometimes residents don't know that rule. If you're up on a ladder, you shouldn't have someone crawling underneath. Read the signs. This is a slippery floor, and she didn't go slow enough, I guess, and she fell. Causes of accidents that can cause injury would be illnesses, being complacent, not doing a job so frequently you're not thinking about what you're doing, being distracted because you're emotionally upset. If something horrible happens at home, if someone dies or you break up with a boyfriend and it's got you extremely upset, you need to call in. We don't want you running around here when you're distracted. Tired because you had too little sleep, you need to make sure that you take care of yourself before you come here. Working recklessly, not thinking that our safety rules don't apply to you, and being selfish, not thinking anyone will be affected by your actions. Once there was a nurse who left an uncapped needle in a resident's bed, and another nurse got stuck, and of course that resident had hepatitis, and of course the nurse got hepatitis. Fooling around is for fools. Do not rush, especially when you're working with people. Be attentive for your training talks, to have a good attitude for safety. Be eager to understand our policies and procedure, and be alert for anything that doesn't feel right. If you walk into a room, sometimes you're not quite sure what's wrong, but something is different. Get another coworker and see if you can figure it out, and stay focused on your job. Please wear non-skid shoes to clean up your spills immediately. And if you have cleaned up a spill, make sure there's a sign posted. Place electrical cords so they're not a tripping hazard like they were in our earlier video. Always walk and don't run. You can walk quickly if it's a fire drill or a fire. And keep equipment out of the halls. Please put it back where it belongs. Who is responsible for cleaning up a spill? You are. Electrical shocks and possible fires. Please report any frayed cords to maintenance. Match plugs with outlets. We should only be using 3-prong outlet cords with a 3-prong outlet. You know, don't cut off the extra prong or anything like that. Don't touch anything electrical with wet hands. Don't overload circuits. Report equipment that smokes, sparks, blow, any kind of fuses or shocks. Make sure that maintenance knows that's not working well. Don't use extension cords without approval. We have lockout tagout law, which means when maintenance is working and shutting off electrical breakers for their work, it should be locked. And if for some reason it's not locked, don't go through playing with breakers. Report any equipment not working properly. Clearly tag it so maintenance knows which piece of equipment it is. And obviously you have to tell maintenance and then report it to your supervisor. But basically you need to take whatever it is that you found out of service and make sure you tag it, because sometimes maintenance isn't there to take care of it right away. We need to lock up chemicals, as I showed earlier in the video, and medications. And when someone's using oxygen, we need to post signs. Staff is very good about that. What can cause hearing damage? Loud equipment like our dryer or our lawnmower. Heat stress or burns can occur from high temperatures, and the things here that we have that have high temperatures would be the dryer, hot water heater, the furnace, stove, the steamer. On hot days too, we need to make sure the patients are getting water, and also you need to make sure you're getting lots of water. Injury can occur from contact with machines with moving parts. What machines here have moving parts? Well, the power lift, the medi lift, the tub, the lawnmower. If you can think of some more, you can add them to the list. If there is an incident, we need to report it within 24 hours, and our supervisor will fill out the form at the end of the shift. If something happens that you're really severely injured, we'd certainly have you get medical attention at the Sleepy Eye Hospital. Do something about something that is unsafe. If you see something, make sure you secure it so no one can get hurt, and then go tell somebody and figure out what to do. Report any concerns that you have about hazardous situations here in the home. And what can you do to work more safely? Some ideas. And basically the summary is to discuss some of the accidents that we've had here at Divine that you know of, and talk about how they could have been prevented. Here's the way it should have been done. She saw the spill, she wipes it up. She posted a sign there as well. She put the knife on the counter, not hanging off the counter. She's got the handle of the pot turned away from the walkway. And now he realizes that maybe I shouldn't drag the fan across the hall. And after using the chemical, I lock it up. Here's the drawer, pulled it out. Come on. Sorry. Okay, now he's going to shut the drawer. There we go. Didn't leave it open like he did before, so it was a tripping hazard. And he likes to act. So, everyone here at Divine Providence is a member of our safety committee. So if you see something, you should tell your supervisor.